The way we finance healthcare keeps wages flat and costs businesses a fortune. Healthcare costs pose a real existential threat to the American economy. There is no doubt at all in my mind that the best way to ensure the competitiveness of American business is with a single-payer healthcare system.
Let's give the taxpayers of the United States a better return on their investment, which means Medicare for all.
Medicare for all will serve to organize and measure the best of our energies and skills to improve American healthcare.
People are talking a lot about Medicare for all, but the phrase means different things to different people. That's not surprising. Many of us don't know a lot about Medicare, so let's talk about Medicare. I'm Dr. Ed Weisbart. I'm a family physician and I'm a member of Physicians for a National Health Program. We all support building a program based upon improving Medicare and expanding it to every American. Before Medicare was enacted, only 51% of Americans over 65 years of age had health insurance. Many of them died because they couldn't afford health care.
We are behind every country pretty nearly in Europe in this matter of medical care for our citizens. What we are now talking about doing, most of the countries of Europe did years ago.
President and Mrs. Johnson and Vice President Humphrey arrive for ceremonies that will make the Medicare bill a part of Social Security coverage.
Today, 59 million Americans are covered by Medicare. It's literally a lifesaver for seniors. Most physicians today support Medicare for all because we see firsthand how broken our healthcare system is.
Does that hurt you at all?
No.
Commercial insurance companies second-guess our clinical judgment on a daily basis.
We're going to get you set up to see Dr. Miller for that injection of your knee.
Thank you very much.
If I write a prescription and they want more information, my nurse has to call up that company. It's not uncommon that they spend 30 minutes with one appeal. So we're trying to figure out the game so that we spend the least amount of time doing that kind of baloney.
Commercial insurance companies add bureaucratic waste to our medical offices and intentionally create barriers to our delivering medical care.
Doctor wanted an MRI ordered. Patient was in excruciating pain, unable to walk. We attempted the MRI and we were told no. The basic Medicare product through the government is just a very easy to follow plan. There's no prior authorizations required. We know what the coverages are, we know what to expect, we know claims payments in and out, we're good.
The typical American physician spends nearly $100,000 per year dealing with insurance, negotiating pre-approvals for tests and treatments, rewriting prescriptions, and generally doing paperwork that does nothing to improve your health. Most of these costs are generated by commercial insurance companies. Beside the waste they create in our medical offices, insurance companies also create tremendous waste in our hospitals.
The administrative costs have skyrocketed. We have a sort of lopsided emphasis on billing and money rather than an emphasis on adequate patient care.
We have people who can't pay, people who have this insurance, people who have that insurance. So there's nurses whose full-time job is to help get authorization so that a patient can get the care they need, and that's ridiculous.
From a nursing point of view, insurance companies are a parasite. They are a complete impediment to our care.
Commercial insurance has become so complicated that the 900,000 hospital beds across the United States require hospitals to employ 900,000 people just for billing and insurance-related work. That's one billing person at the foot of every hospital bed.
If we did not have that money administratively siphoned off and put it back into patient care, there would be more than enough money to have adequate nurse-to-patient ratios and thus improve the quality of care and reduce nurse burnout.
Commercial insurance companies are disruptive middlemen that add cost while diminishing the quality of care. We could make the healthcare system much simpler and much less expensive if we had Medicare for all. On international comparisons of preventing death from curable diseases, the United States ranks dead last out of 19 advanced countries. Our low ranking is primarily caused by barriers to getting health care.
Emergency rooms are always crowded now with patients who don't have insurance. Patients don't have primary doctors. Because many people have delayed care for so long, by the time they do come to the emergency room, their health condition has deteriorated to the point where they need to be hospitalized.
1 in 3 Americans can't afford to get basic care. But when my patients make it to age 65 and join Medicare, this catastrophe reverses. My patients can suddenly get that biopsy, that cardiac stress test, or even that treatment for cancer. One of my 64-year-old patients needed urgent surgery to open up a blocked carotid artery, but she told me that she would pray and wait until she turned 65 and got Medicare. Doctors like me see this over and over again, and it makes us sick and frustrated and angry, and we're always so relieved when our patients reach Medicare age. Compared to commercial insurance, Medicare is more effective at cost control. Commercial insurers typically pay at least 20% more than Medicare for the same services and devices. In the case of hospitals, the Congressional Budget Office found that, on average, commercial insurers pay 89% more than Medicare. Payment contracts between hospitals and commercial insurance companies are done behind closed doors, in secret. In Massachusetts, the Attorney General had to issue a subpoena to get access to this secret information and find the real cost of healthcare. They found that pricing for procedures could be up to 10 times higher in some hospitals. They also saw radical price differences within the same hospital depending on who was paying. In comparison to the chaotic system of commercial insurance pricing, Medicare sets payment fees based on a thoughtful process of evaluation of services.
If we took those prices and applied them automatically to the entire private health insurance system, we would save billions of dollars in this country, just with that one change.
In addition to saving money by sensible pricing of services and devices, Medicare also eliminates much of the waste seen in commercial insurance. Medicare operates with an overhead of 2%. Compare that to commercial insurance companies that typically operate with an overhead of 15% or more. That's more than 7 times the overhead cost. Medicare operates today with just 6,100 employees, compared to 470,000 employees in the commercial health insurance sector. Medicare does not have thousands of employees working in sales and marketing and claims denial. Medicare does not need to earn an ever-increasing bottom-line profit to satisfy Wall Street. Medicare does not pay multi-million-dollar executive salaries. Hospital administrative costs run $667 per capita per year in the United States. That's 4 times as much as the $158 they spend in Canada. No other country comes close to wasting money like we do, and it's primarily driven by our chaotic and needlessly complicated commercial health insurance system. Americans with traditional Medicare can go to almost any doctor, any hospital, anywhere in the United States. Traditional Medicare patients don't have to worry about restricted networks of doctors and hospitals. Americans with traditional Medicare are free to choose where and how they get their health care, even crossing state lines whenever they want to. No permission needed. Commercial insurance is totally different. It typically limits your choices.
As a matter of fact, we don't choose our insurance companies in general. It's your employer, if you're getting your insurance through an employer, that chooses the insurance company. And that's really not based on the quality of the insurance most of the time. Most of the time it's based on the cost to the employer.
Medicare for All is the only way to get the freedom of choice that Americans want. The main things we need to improve in Medicare are to make the benefits more comprehensive and eliminate the co-pays and deductibles that make many Medicare patients need to buy a supplemental policy or join an Advantage plan. The so-called Medicare Advantage plans are completely different from traditional Medicare. These plans are sold by commercial insurance companies and add both cost and complexity to the system. Advantage plans operate at overhead rates that are 4 times higher than traditional Medicare. Medicare Advantage plans waste our tax dollars. They manipulate Medicare into overpaying. One study showed that between 2008 and 2016, these overpayments added up to $174 billion. Expanding traditional Medicare can offer all of the benefits of the Advantage plans without the disadvantages and the added costs. By eliminating bureaucracy of commercial insurance and empowering Medicare to set sensible fee schedules for things like prescription drugs, the savings will fund the needed improvements. The conclusion that so many physicians draw is that when we finally expand our Medicare system to our entire population, the health of the United States will skyrocket to the best in the world. Improved Medicare for all. It's simple, it's prudent, and it's proudly American.